Obamacare did not make health care affordable for my family. Before the law, a blood product that my son infuses weekly had a $16 copay year-round. Now we're finding that we have to come up with $6,000 at the beginning of every year to pay for these IgG infusions. And drug company assistance programs are overburdened because of Obamacare. So my question is, how can anyone say that the law is working when it has made once affordable, life-saving medications so unaffordable?
Now, before you get too happy, Stephen, now because that's a very good question. Yeah. But listen, she's concerned about these deductibles, and a lot of people are. As you answer her question, I also want you to explain to me, are you sure your plan is going to actually lower the deductibles? Because that seems to be the main pain point. You demagogue it sometimes, but I don't know. I have not seen one thing that's going to bring down the deductibles.
Well, in fact, some people want to buy higher deductible plans because if you do that, your premiums are going to come down. I mean, think about this. I mean, what is the purpose of insurance? Insurance is to protect against the big events, like your house burning down or something. That's why we have homeowners insurance. So you want for routine medical expenses, for the most part, Americans should be able to pay those out of pocket. You want insurance so that if you get cancer or you have some kind of serious expense, that everyone is covering for it. So a high deductible policy is not necessarily a bad thing.
Look, you and I see the world completely differently. I mean, which is not going to shock you. I actually don't understand why we have health insurance companies at all, for the very reason that you just said. Insurance should be for stuff that you are not sure about.
Right,
you don't know if your house is going to burn down, you get fire insurance.
That's
you don't know
exactly
if you're going to have a flood or your crop's going to fail. Flood insurance makes sense. Crop insurance makes sense. I am sure I'm going to see a doctor. I am sure. Even if it's just to sign the death certificate, I'm going to see a doctor. So why do I need a big insurance company? I don't need health care insurance. I need health care. And that's what most countries have. They have health care, not health insurance companies profiteering.
Okay, let me